Namaste. I'm Dr. Maya Murdeshwar from the Department of Life Science and Biochemistry at St. Xavier's College, Mumbai. In this series of lectures, I would like to walk you through Ayurveda, the science of life, from ancient to modern times. Ayurveda is a traditional form of medicine being practiced in India since ancient times, more than 3000 years. It is a holistic form of medicine with both curative and preventive aspects. Ayurveda has withstood the test of time and is practiced and very much relevant even today. Through these lectures, I would like to emphasize that point that Ayurveda is not an alternative form of medicine, but is a mainstream medicinal science discipline with its premises strongly rooted in observational and scientific basis. The aim of these lecture series is to introduce learners to the traditional Indian medicinal system of Ayurveda, to familiarize learners with the scientific knowledge in our ancient texts, to explain the fundamental concepts of Ayurveda, to compare Ayurveda with modern medicine, and to explore the relevance of Ayurveda in current times. I will also be outlining the current research that is ongoing in this area using modern scientific methods. And we will conclude this lecture series by looking at the various Government of India initiatives to promote Ayurveda. At the end of this course, the learner will be able to recall the history of Ayurveda through its ancient practitioners and ancient texts, will be able to provide specific examples of the scientific knowledge in these Ayurvedic texts. The learner will be able to discuss the basic principles and concepts of Ayurveda and compare the Ayurvedic approach to life and health as opposed to current day modern medical practices. The learner will be able to identify the relevance of Ayurveda as a personalized system of medicine in current times and will also be able to describe and provide more information about the ongoing research in this area and the Government of India schemes that are currently in place to promote Ayurveda. With this brief introduction, let us start this beautiful journey of Ayurveda, the science of life. In this first lecture, we will begin by asking the question, what is Ayurveda? We will study its history and then move on to delve into the principles of Ayurveda like the Panchamahabhuta theory, the Tridosha theory and the Dosha-Dhatu-Mala theory. And we will conclude this lecture with an overview of Ayurvedic diagnostic and treatment strategies. Let us begin by asking the question, what is Ayurveda? The word Ayurveda can be divided into two Sanskrit words, Ayuhu meaning life and Veda meaning knowledge or the science of. So Ayurveda is essentially the science of life. Ayurveda forms a part of Atharva Veda, one of the four major ancient scriptures of India. Ayurveda is considered to be traditional Indian medicine dating back to more than 3000 years. Ayurveda has a holistic approach to health and well-being. It is in tune with nature and it covers all the aspects of life and the interconnectedness therein, the connections that lie within. The main goal of Ayurveda is not to fight disease. The main goal of Ayurveda is to promote good health and to prevent disease. It does so by focusing on three main aspects, which is ahara, that is wholesome nutrition, vihara, leading a disciplined way of life, and achara, that is righteous and moral living in tune with nature. So Ayurveda is a complete science of medicine, of health, and it was a way of life in ancient India. It was not just used for its curative nature as it is done today, but it was practiced on a day-to-day basis in every tiny little aspect of life. The goals of Ayurveda are twofold. It is mentioned in the Charaka Samhita, one of the major treatises of Ayurvedic texts. It says, Swasthasya swasthya rakshanam, to protect the health of the healthy individual, and Aturasya vikara prashamanam cha, to treat the disease of the patient. Atur means tormented. The person tormented by disease, by illness, to treat such a patient. Ayurveda meets these two goals by two ways. One is its preventive nature, and the other is its curative nature. The emphasis, however, is on preventing illness and promoting good health. This, as we already discussed, is through wholesome diet, disciplined way of life, and a righteous living. And the curative aspects discuss cleansing or purification techniques like panchakarma, the use of medicines and herbs, rejuvenating or anti-aging therapies, and external therapies like various forms of massage. The Ayurvedic approach to wellness is a holistic approach. It's a complete approach ensuring complete spiritual, physical, emotional, and mental well being. It is both preventive and curative in nature, and most importantly, it is health promoting. The focus is on health and well being and not on disease and its cure as such. Let us now talk a little bit about the history of Ayurveda. Where did all this begin? Where did this science come from? We begin with a little bit of mythology, where we talk about the churning of the Milky Ocean, the Samudra Manthan of the Kshira Sagar, the Milky Ocean. So this has mention in Bhagavad Puran, Vishnu Puran, and Mahabharata, the ancient texts of the ancient mythology of India. So in the eternal war between good and bad, between the gods and the demons, they decided to fight for the elixir of life, Amrita. In this, they decided to churn the ocean to see what lay at its depths, the treasures that lay buried deep inside the ocean. To do this, they needed to churn the ocean. So they used Mount Mandara as the churning rod. Lord Vishnu, in the form of Kurma or a tortoise, formed the base of this rod so that the rod did not dip into the ocean. And Vasuki, the snake god, was used as the churning rope. The demons took the head part or the part below the hood of the snake as to churn the ocean, and the tail part was taken by the gods. They continued to churn this ocean, and the ocean turned out various treasures, including goddess Lakshmi, including Kamadhenu, the all-giving cow. And one of the treasures that it churned out, which is relevant to our study here, is the Amruta, in the Amruta Kalasha, in the vessel that contained this. And it was brought forth by Dhanavantri, the physician of the gods. Dhanavantri is believed to be an incarnation or an avatar of Lord Vishnu himself. He is also depicted in a similar manner, having 4 arms, Chaturbhuja, and each of these arms holds a particular item. Like in some forms, he is depicted to hold the Shankha and Chakra, the symbols of Lord Vishnu. In the image shown here, Lord Dhanavantri is shown to have the Shankha or the conch. In the other hand, he holds the Amrita Kalasha, the Kalasha or the vessel which contains the elixir of life that imparts immortality. In one hand, he holds the Ayurvedic texts and in the other, the medicinal herbs. In some references, he is also shown to hold a leech, which is one of the organisms that is used for bloodletting, a type of treatment in Ayurveda. Lord Dhanavantri is known to have obtained the science of Ayurveda, the principles of Ayurveda from Lord Brahma, and he is known to have passed this on to the ancient sages through their meditation, through their reflection. They obtained this knowledge from Lord Dhanavantari. Some of these ancient sages are Maharshi Charaka, Maharshi Sushruta, and Acharya Vagbhatta, but these are only three of the most renowned of Ayurvedic practitioners from ancient India. There are several Ayurvedic texts, but three of the major treatises, which are called the Brihat Trai, the big three, are the Charaka Samhita, the Sushruta Samhita, and the Ashtanga Hridayam Samhita by Acharya Vagbhatta. So we will discuss a little more in detail about these practitioners and these texts. Maharshi Charaka is known as the father of Ayurveda. He was known to be an expert in human anatomy and physiology, in embryology, the development of humans from a single cell to the complete organism as we see it, in pharmacology, the study of medicines, of drugs, their formulation, blood circulation, the beating of the heart, how the blood circulates in the body, carrying with it nutrition and life-giving oxygen to various parts of the body, and collecting wastes from the various cells and bringing it out for excretion out of the body. He was also an expert in various diseases like diabetes, tuberculosis, and heart disease, just to name a few. Maharshi Charaka believed that health and disease are not predetermined. The lifestyle and environment of an individual play a major role in determining the health of an individual. And simply by modifying the lifestyle, the dietary habits, and the environment that a person lives in, a person can lead a healthy and wholesome life. The Charaka Samhita, the compendium of all his sutras, of all his principles that he put together, that he compiled, is a major treatise that is used as an Ayurvedic study in Ayurvedic colleges even today. It consists of 8 books with over 120 chapters, which talk about these ancient theories on the human body, the etiology or the progression of disease, pharmacology, the treatment, the therapy of these diseases. The Charaka Samhita also details the identification and classification of various plants, plant parts like the flowers, the fruits, the leaves, the roots, the stems, the bark of various shrubs, herbs, and trees of medicinal importance. It talks about the classification of various animals and animal products, right from their milk to their excretory products, and how these products change based on a change in the diet of these animals, and the composition and how this then affects human health. The Charaka Samhita also discusses Ahara Tattva, that is dietetics and hygiene. It not just highlights all of this, but it also talks about medical education and the synergy of the doctor, the physician, the caregiver, the nurses, and the patient that is necessary for the complete recovery back to health from any illness. That is the knowledge present in Charaka Samhita. Maharshi Sushruta is the other renowned Ayurvedacharya, who is also known as the father of surgery. In this very famous painting by Robert Thom, you see Maharshi Sushruta in the process of performing a surgery with his students and attendants in service. I would like to draw your attention to the image at the start, at the side, which outlines or which shows the various surgical instruments that were used in those days in ancient India by Maharshi Sushruta. Just look at the various shapes. Each of these surgical instruments, and only a few of them are shown here, each of them has a very distinct shape, and the shape determined the function for which they were used. Each had a very unique function, a unique role to play in the kind of surgeries that were carried out. If this is not science, then what is? Maharshi Sushruta compiled all the knowledge that he had about Ayurveda into what is known as the Sushruta Samhita. This is another very important reference that is used in Ayurveda, in the study of Ayurveda in current times. The Sushruta Samhita has around 186 chapters, and it outlines over 1,000 diseases, 1,000 illnesses and their cure. It talks about several hundred plant, animal, and mineral preparations that are used to cure these diseases. How do you obtain them? How do you process them? What formulations to use? When to use? How much to use? Everything is outlined in this text. The Sushruta Samhita has a detailed sections on surgical training, on instruments that are used in surgeries, and it outlines step by step a detailed procedure for various surgeries like amputations, the removal of organs, the removal of different parts of the body as a curative form, rhinoplasty, that is nasal surgery, and how skin from the cheek can be used to reconstruct a broken or a removed nose is highlighted in Sushruta Samhita very much in detail. It talks about various forms of plastic surgeries, of eye or ophthalmic surgery, of various gynecological procedures, and complications that can occur during these surgeries and how to overcome them. It is a beautiful treatise to deal with surgeries and to deal with the other aspects of Ayurveda as well. Acharya Vagbhatta is the most famous disciple of Maharshi Charaka. He is known to have written various Ayurvedic texts which are in use even today, two of which, the Ashtanga Hridayam in a poetic form and Ashtanga Sangraha as a prose, are very, very famous. Acharya Vagbhatta believed that 85% of the diseases do not need doctor's intervention to be cured. They can be cured simply by change in our dietary habits, in our lifestyle, and the way we lead our lives. Only 15% of these diseases require the intervention of a medical practitioner and the consuming of certain drugs, certain medicines, and the use of certain medicinal procedures. Ashtanga Hridayam Samhita, or compendium, compilation of Acharya Vagbhatta, outlines the 8 branches of Ayurveda: Kaya Chikitsa, or internal medicine; Shalya Chikitsa, surgery; Balaroga Chikitsa, pediatrics, which also includes the study of gynecology; Rasayana Chikitsa, rejuvenation or anti-aging therapies relating to old age or geriatrics; Vajikarana Chikitsa, those dealing with reproductive health; Agada Tantra, toxicology; Manasa Roga Chikitsa, psychiatry, to deal with mental disorders and to deal with the mental and emotional health of individuals; and Shalakya Chikitsa, those referring to ENT, the ear, nose and throat. Ayurveda, as you can see, is a complete medicinal science. It's a complete discipline. It's not an alternative form of medicine. It is medicinal science itself, coming from ancient India. The Ashtanga Hridayam Samhita consists of more than 7,000 verses that deal with the cause of illness, how to diagnose these diseases, how to treat them. It discusses the Prakriti or the individual constitution of a person, personal hygiene. It talks about aging. It talks about the influence of season and time on the health of individuals. It deals with a sense of taste and how this changes with the changing health status of an individual. It deals with pregnancy, the complications during birth, and it deals in details with panchakarma, purification techniques that are used to treat these various illnesses. These are just a few of the topics that are outlined in Ashtanga Hridayam Samhita. In our lecture so far, we have looked at Ayurveda as a traditional Indian medicine, its goals, its approaches. We discussed the history of the Ayurveda from mythology, and then we also spoke about the ancient Indian Ayurvedic practitioners and the Ayurvedic treatises, the Brihat Trayi that they combine. Let us pause this video for just a minute and check if we have or if we can recall what we have just studied. Match the items in column A with those in column B. Here are the answers. Father of surgery, Maharshi Sushruta. The presiding deity of Ayurveda, Dhanvantri. The 8 branches of Ayurveda were proposed by Acharya Vagbhatta in his Ashtanga Hridayam Samhita. And health and disease are not predetermined, but are based on one's lifestyle and environment. This was proposed by Maharshi Charaka. We will now move on to the next section of this talk. In this section, we will delve deep into the principles of Ayurveda. We begin with the Panchamahabhuta theory, or the theory of the 5 elements. According to Ayurveda, human beings and all living systems, all non-living systems, are thought to be made up of 5 elements. Moving from the gross to the subtle, these are Prithvi or earth, Jalaha, water, Agnihi or Tejaha, which is fire, Vayu, that is air, and Akasha, space or ether. All systems are made of these 5 elements. These 5 elements can also be represented in the palm of our hand. The thumb stands for fire, the little finger for water, the index finger is air, the ring finger stands for earth, and the middle finger stands for space. These 5 elements make us all up. These 5 elements then combine in the human body, in the body of other living organisms, as also in the non-living systems. And especially in the living systems, they combine to form 3 life forces, which are called Tridosha. Tridoshaha, singular, Tridoshaha, plural. These 3 doshas or life forces, according to Ayurveda, are the Vata dosha, made by combining the Vayu and the Akasha Tattva, the elements of air and space. Pittaha, made by combining Agnihi with Jalaha, fire and water. And Kaphaha, which is the grossest of them all, made by combining the element of water, Jalaha, with earth, Prithvi. So Vata, Pitta and Kapha are the three doshas that are present in all living organisms as life forces. But dosha usually means a fault. Then why are we calling these life forces as dosha? The reason is that in Ayurveda, if the balance between the Vata, Pitta and the Kapha life energies is not balanced, they are in imbalance, that is what causes illness. That is what causes the chaos. And this capacity to cause the imbalance, to cause chaos, is why these three life forces are called doshas. So the three doshas in Ayurveda are the Vata, Pitta and Kapha. These three doshas have different characteristics. They also are classified into sub-doshas. For example, the Vata dosha made of air and space represents kinetic energy, represents the movement that the air represents. And the subtypes are five Vayus or Panchavayu, Pranaha, Vyanaha, Udanaha, Samanaha and Apanaha. Just like the elements that they are formed from, this Vata dosha is thought to have the characteristics of lightness, of coldness and dryness. It controls all the activities and the movement in the human body. It controls communication between the brain and the various parts of the body, communication between two different cells, communication between the individual molecules that form the cells. Vata dosha is also known to control memory and perception, and it predominates in old age. And just like the maturity and wisdom which come with age, the Vata dosha is known to impart maturity and wisdom to the individuals who possess this dosha in larger proportion. The Pitta dosha, made of the elements of fire and water, Agnihi and Jalaha, is further subdivided into Ahara Pachakaha, Ranjakaha, Sadhakaha, Bhajakaha, and Alochakaha Pittaha. Fire and water combined make it fiery, hot, and mobile. Pitta dosha is known to control hunger, thirst, and appetite. It also controls the qualities or the emotions of anger, fear, and bravado. It is known to impart vision, a visionary thinking. It is known to enhance comprehension, data analysis, and decisiveness in individuals. Pitta dosha predominates in youth and adulthood, and it is this characteristic of dynamism and transformation that it imparts to this stage of life. Kapha dosha, made of the elements of water and earth, of Jala and Prithvi, represents potential energy. It is further classified as Bodhaka, Kledaka, Tarpaka, Shleshaka, and Avalambaka Kapha dosha. Being the grossest of them all, the Kapha dosha imparts heaviness. It represents stability and it imparts moistness. Kapha dosha is known to lubricate the different parts of the body and to provide support. It provides structural stability to the body. It improves mental strength. It boosts immunity, and it is known to have the characteristics of childhood and adolescence, which are synthesis or growth and innocence. So these are the three doshas, the subtypes, the characteristics, and the age of life in which they predominate. The next three slides represent in an illustrative manner, in a diagrammatic manner, the subtypes and the sites of the Vata dosha as shown here, the Panchavayus, the Pitta Dosha and the sites of action. The Pitta dosha mostly in the intestine and the stomach. It predominates the digestive system, but also plays a role in maintaining the gray matter of the brain. It maintains eyes, the blood flow, the liver, the sweat, and so on. The kapha dosha predominates in the lungs, in the respiratory tract, but it is also connected to the taste, to the pancreas and the digestive juices that are secreted, to the lymph nodes, to immunity, and to the blood flow, and also the synovial fluid, the fluid between the joints that lubricates the body. Every individual has all the three doshas present, but to a different extent. The proportion of one or two of these doshas is more in an individual as compared to the other, and therefore, based on the proportion of the three doshas present in an individual, no two individuals, no two people have the same balance of these doshas. And therefore, the constitution of each individual is unique. This is the basic premise of Ayurveda, that each individual has a unique Prakriti, a unique constitution made up of Vata, Pitta, and Kapha in balance with each other. Any ailment, any illness that is caused is because this balance is disturbed. The Vata, Pitta, and Kapha balance of one particular individual is disturbed. And the entire focus of Ayurveda is on promoting health and preventing illness by retaining this unique individual balance or the unique Prakriti of an individual. The Tridoshas can become imbalanced based on our daily lifestyle and also based on seasonal variation. For example, the three doshas have seasons in which they gather or they accumulate, which is called sanchaya. There are seasons in which they heighten or they aggravate, causing illnesses, which is called prakopa. And then there are seasons in which they undergo a lessening or healing, which is called prashamana. For example, the Vata dosha is heightened in the Varsha Ritu or the monsoon season. The Pitta dosha, digestive disorders, are seen to occur more in autumn or the months of September, October. And the Kapha dosha is heightened in Vasanta or the spring season, Vasanta Ritu. Based on these seasonal changes, Ayurveda prescribes not just a daily routine, which is called dinacharya, but also specific rituals or specific disciplined lifestyle to be followed according to the changing seasons, which is called a rutucharya. How to live a disciplined life, what to eat, how much to eat in the different seasons. And as the seasons change, that is when the doshas are imbalanced. They are either heightened or lessened. That is when certain treatments are also prescribed by Ayurveda to bring back a balance and to maintain health. These tridoshas also result in different individuals having different physical characteristics. For example, an individual with a Vata Prakriti, with a Vata dosha in more proportion as compared to Pitta and Kapha, is seen to be thin, lanky, and slender, a slender body, low body weight. The skin is usually rough and dry, hair is dry and brittle, and they are seen to have a lively, enthusiastic, and changeable temperament, just like the air and the ether, the space, the elements that make up the Vata dosha. An individual with Pitta dosha is seen to have a medium build, is seen to have a muscular body, and they are seen to be more purposeful and intense. A person with Kapha predominance, with the Kapha dosha, is usually seen to be large and stocky. They are more plump or heavy, so to say, but they are easygoing and they are more accepting. They are grounded, just like the earth and the water elements that make this. So based on the Vata, Pitta and the Kapha doshas that predominate in an individual, that make up that unique Prakriti of that the individual is seen to have certain physical, mental and emotional capabilities as well. And the goal of Ayurveda is to maintain this balance so that the individual leads a happy, healthy and wholesome life. Thus far in our lecture, we have spoken about the Panchamahabhuta theory. We have discussed the Tridoshas, the Vata, Pitta, the Kapha, their types, their subtypes, the characteristics, how a combination of these Vata, Pitta and Kapha dosha go on to make the unique Prakriti or constitution of an individual, and how seasonal variations lead to an imbalance in these doshas and lead to a different physical, mental, and emotional attribute of an individual. Please pause the video for a minute now and answer this question. Match the items in column A, column B, and column C. Column A referring to the dosha, column B the constituent elements that form the dosha, and column C the age in which this dosha is predominant. Here are the answers. The Vata dosha is made up of the elements of air and space and it predominates in old age. The Pitta dosha is made up of fire and water and it predominates in youth and adulthood. The Kapha dosha is made up of the elements of water and earth and it predominates in childhood and adolescence. We will now continue further into these fundamental principles of Ayurveda. Let us now see how these doshas come together to cause illnesses. What is the premise of health and disease in Ayurveda? We will then discuss the Dosha-Dhatu-Mala theory, and let us look at what all these terms mean. The dosha, dhatu and mala form a tripod or form the three pillars of health and well-being in Ayurveda. According to the Sanskrit verse, dosha dhatu malaha moolam hi shariram. These are the essence of health. Dosha meaning the life force or the life energy, the vata, pitta and kapha. The dhatu meaning the tissues that form the body. The malaha are the metabolic end products or the excretory material, and the interaction between the life energy, the tissues and the wastes is what determines whether a person is in good health or not. These three pillars can function to their best only in the presence of Agni. And this Agni or the Teja is also of various types. So let us now look at this theory in slightly more detail. We have discussed the three doshas. Let us look at the Sapta Dhatus, the seven tissues, the food that we eat, the ahara that we consume is converted in the body into seven tissues. These are rasaha or the tissue fluids, the intracellular fluid, the fluid which is inside the cell, the various body fluids, the cerebrospinal fluid, blood, plasma and so on, all the tissue fluids, they are termed as rasa. Rakta, that is blood, and all the various blood cells. Masa. Masa is the muscle that is present in the body. Meda, referring to the fatty tissue, to the connective tissue that is present. Asthihi. Asthihi is the bone, the skeleton that forms the body. Majja is the bone marrow that gives rise to all these different cell types. And Shukraha refers to the reproductive cells like the sperm and the ovum. All of these seven, the Rasa, Rakta, Masa, Meda, Asti, Majja and Shukraha together make up the seven tissues of the human body, the Sapta Dhatu. The three types of excretory products that Ayurveda talks about are Purishaha, feces or the stools, Mutraha, urine, and Svedaha, sweat. Now these doshas, the Saptadhatus, and the three types of Malaha or metabolic waste products are together combined in a manner, are balanced in a manner to determine a person's health or disease state. However, all three of them function to their optimal best only in the presence of Agni. Agni is the driving force for life, just like the sun is to the earth, to all the living systems on our planet Earth. Agni in Ayurveda is classified into three types: Jathar Agni, Jathar Agni or Jathar Agni, which is the digestive fire present in the stomach region; Dhatu Agni or Dhatu Agni, the Agni which is present in the tissues, the Sapta Dhatu that we just spoke about; and Panchabhutagnihi, Panchabhutah Agnihi, the intracellular and any elemental form of Agnihi in the five elements or the Panchamahabhutas. It is only when all these three subtypes of Agnis are at their brightest, are burning at their brightest, that good health is maintained. These Agnis can either be in complete balance, which is called the state of Samagnihi or Sama-Agnihi, which leads to balanced metabolism, good health, well-being. When this Agni is irregular, sometimes heightened, sometimes lowered, sometimes normal, but very irregular, it is called Vishama Agnihi, and that leads to irregular metabolism. When Vata dosha is aggravated, Vishama Agni is seen, or Vishama Agni leads to Vata dosha. Tikshna Agnihi is sharp rise in the Agnihi, which is seen in Pitta dosha. That leads to hypermetabolism, fast metabolism of the body. And when the Kapha dosha predominates, so when there is Mandaha Agnihi, that is a lessened Agnihi, that is when the body shows hypometabolism or a very slow, gross, heavy kind of metabolism. And this is how the presence or absence or increase or decrease of these Agnis and their interaction with the doshas, the dhatus and the malas, the interactions together lead to good health or illness. As per Ayurveda, the definition of good health and well-being is given in the Sushruta Samhita, chapter 15, verse 10, and I'm going to read it out to you. Samadoshaha samagnischa samadhatu malakriyaha prasanna atma indriya manaha swastha iti abhidhiyate. Samadosha, balanced doshas, vata, pitta, kapha in balance. Samagnihi, all the three agnis in balance. Samadhatuhu, the sapta dhatus, seven dhatus in balance. And so the malakriyaha, the excretory processes working fine. This leads to prasanna atma, a pleasant, blissful state of the soul, of the senses, indriya, senses, and the mind, manaha, and this is where health abides. So, samadosha samagnischa samadhatu malakriyaha prasannatmendriya manaha swastha iti abhidhiyate. That is the definition of health according to Ayurveda, which tells us that it's a complete psychosomatic equilibrium that leads to good health. This is the science in Ayurveda. So much depth in it. So what is ill health then? Ill health is the result of Ama. Ama are the unmetabolized toxic waste products which cannot be utilized in the body but are present within the body. They are not excreted out. This ama is the result of improper digestion. They are the result of low jathar agni. They are the opposites of Sara. Sara refers to the nutritive juices, the healthy juices that bathe the Sapta Dhatus and keep them in good health. But when the Jathar Agni is not fine, the digestive process is not fine, these nutrients cannot be efficiently extracted from the food or the ahara that we consume, and that leads to the formation of toxic waste products in the body which remain in the body and are not excreted out. These are called as ama. Now the formation of ama is a normal process during the digestion, the day-to-day digestion. However, it does not stay in the body because excretory systems of the body keep removing it out. However, if the digestive and the excretory systems are hampered in any way, that leads to the accumulation of ama in the body, and that causes various diseases and illnesses by causing an imbalance in the tridoshas. This state of imbalance of tridoshas is called amavastha or ama avastha, and that is a major therapeutic problem that is addressed through Ayurveda. The signs that a person might have an ama accumulation in the body are that the person does not feel like eating, that is anorexia. The person feels nauseous. The person might also vomit. These are the signs of the accumulation of toxic waste products or ama in the body. What are the causes of ama? Ama, like we already mentioned, is caused due to an improper digestion or low Jatharagni. It is caused by overeating, eating more than the body's requirement. The body sends us signals as to how much it needs, and we must keep that in mind. We must be mindful of the signals that the body sends and eat only as much food as is required as per the body's requirements. Other than overeating, it is also the eating before the previous meal is completely digested. That is eating when we are still feeling full. We are not feeling hungry and we continue to eat. That leads to the accumulation of ama because the previous meal is not completely digested and we are burdening the digestive system with fresh ahara. Consuming improper food combinations. The most common ones that we see in current times is consumption of milkshakes. Milkshakes combine a variety of fruits or fruit pulp with milk. Many of these fruits contain organic acids. Some of them are citrus in nature. This causes the curdling of the milk, and that leads to ama formation. It is fine to consume curdled milk, which is curds, but it is not advisable to consume fruit juices and milk together as a combination, which will lead to curdling inside the body. The other example is to consume curd or buttermilk along with non-vegetarian food items. So these improper food combinations result in the formation of ama. Improper food habits like skipping meals or eating very late dinners beyond sundown time or irregular meal timings, all of these cause ama. Eating food which is either too cold or too hot or which is uncooked, not completely cooked, which is deep fried or which has a lot of spice in it, all of these lead to the digestion not occurring properly and cause ama. Also, The lack of exercise, the lack of an active lifestyle, the lack of a disciplined daily routine leads to the formation of ama. And so does the hectic lifestyle with high stress levels. I think if we consider our current lifestyle as of today, we will check most of the boxes for ama formation. And therefore, we need to make necessary lifestyle corrections so that the ama production in the body is reduced. So how do we counter this ama? We take a three-pronged approach. The first, of course, is to prevent the formation of ama. No ama formed, no illness, no disease. However, if the ama is already formed inside the body, then we need to take measures to excrete it, to remove it out. So this is usually done through dietary interventions, some changes made in the diet, or through the consumption of some herbal medicines, or through cleansing processes like vamana and virechana, induced vomiting and induced excretion. This is when the ama has to be removed out of the body. But what if the ama is already formed and absorbed by the dhatus? It is already present inside the cells. In such a case, the only recourse to be taken is to strengthen the tissues, to strengthen the dhatus by the consumptions of various medicines and by various Ayurvedic cleansing and treatment procedures. So these are the three ways in which ama can be countered. So in this section, we have looked at the principles of Ayurveda in terms of the Dosha, Dhatu and Mala theory and how the driving force of Agni helps these to remain in balance and therefore maintain good health. We looked at the definition of health as per the Sushrut Samhita, where all of these factors and influences that we spoke about are in complete balance. And then we discuss the concept of ama, how ama is formed and how to treat this ama, the toxic wastes that are formed in the body. Please pause the video for a couple of minutes and answer these questions. You may write them down. Enlist the factors that lead to ama formation. What changes will you incorporate in your diet and in your dietary habits in order to counter the ill effects of this ama? What changes will you incorporate in your lifestyle to counter the ill effects of ama? Please use this exercise to analyze your daily dietary and lifestyle habits and come up with answers which are going to benefit you, which will help you overcome the ill effects of ama. Having understood the fundamental concepts of Ayurveda, the Vata, Pitta, Kapha, the Tridoshas, the Dosha-Dhatu-Mala concept, the concept of Agni, and having understood the ill effects of ama, let us now move forward to look at Ayurvedic diagnostic and treatment strategies. Diagnosis in Ayurveda uses a twofold approach. Rogi pariksha or the examination of the patient and Roga pariksha, examination of the disease. Rogi pariksha is done by a tenfold methodology which looks at 10 different aspects of the patient. This is called the Dashavidha pariksha. What are these aspects? The Prakriti or the unique constitution of the individual is checked for. The Vikruti or the individual's susceptibility to diseases and illnesses. Sara, the quality of the Sapta Dhatus, the tissues. Samhanana, the compactness of the body. Pramana, anthropometry or the body part measurements, or to put it simply, the proportions of the various parts of the body, whether they have swollen, whether they are the correct size. Satmaya, that is adaptability to changing conditions. Sattva, mental stamina. Ahara Shakti, that is the digestive power, Vyayama Shakti, physical strength, and Vaya, that is the age of the individual, and it also refers to the rate of aging. So these 10 give a complete physical and mental health status of a person. And this is what the Ayurveda Charya or the Ayurvedic doctor or practitioner uses to diagnose the health or the diseased condition of a patient. Then there is the Ashtavidha Pariksha or 8 body examinations that are used or that are helpful in diagnosis. It is given by this shloka. Gadakantasya dehasya sthananyashtau parikshayet nadim mutram malam jivha shabda sparsha drugakritihi. What does this mean? Gadakantasya dehasya sthanan ashtau parikshayet. The 8 body parts of a patient or of a person who is ill need to be measured. And what are these? These are the Nadi or the pulse, Mutra, urine, Mala, the feces or the stool, Jivha, the tongue, Shabdaha, not just the voice, but also the voice of the body parts, like the creaking of the joints, maybe for a person with arthritis, or the rumbling of the stomach. All these sounds that the body makes are examined. Sparsha, touch. The physician touches various parts of the body to check their health status. Drik, referring to the eyes or the netra, and Akriti, which means the build or the physique of a person. So Nadi, Mutra, Mala, Jivha, Shabda, Sparsha, Druk, and Akriti. These are the 8 body examinations as prescribed by Ayurveda for Ayurvedic diagnosis. The diagnosis in Ayurveda is done through pulse examination, which is called Nadi pariksha. Nadi refers to energy channels in the body, and through Nadi pariksha, through the examination of the pulse, the flow of energy in the body is measured. Nadi pariksha is done by the Ayurveda Charya by using their right hand and placing the index finger, the middle finger, and the ring finger very near the wrist area, close to the radial artery. The index finger senses the Vata dosha, the middle finger senses the Pitta dosha, and the ring finger senses the Kapha dosha. The strength, the rhythm, the speed, and the quality of the nadi tell the physician the health or the diseased status of that individual. They identify, the Nadi Pariksha identifies dosha imbalances. It identifies the current health status of the individual, and also the Nadi Pariksha can indicate any risk that the person might have become susceptible to various diseases. The mention of Nadi Pariksha is in an ancient text of Ayurveda called the Sharandhar Samhita. This text also mentions that the nadis, the 3 different nadis for Vata, Pitta and Kapha flow in a different manner. The Vata nadi, because it is the Vata dosha is made up of air and space, moves just like that, fast like a serpent, like a snake, sarpa. The Pitta Nadi is jumpy, it's like a frog, Manduka, and the Kapha Nadi is steady and smooth and moves smoothly, flows like the swan. So, any change in these kind of movements of the 3 nadis signifies an imbalance in the Vata, Pitta and Kapha dosha, and therefore it can be used to diagnose the imbalance. And once medication is prescribed or some kind of a lifestyle change is prescribed, the Nadi Pariksha also helps to monitor the recovery back to health. There is another shloka which tells the importance of Nadi pariksha. Rugnasya mugdhasya vimohitasya deepah padarthaniva jivanadi pradarshye doshajan niswarupam vyastam samastam yugali krutam cha. The pulse displays the doshas of the patient, and these doshas are like lamps in the dark. Where nothing is known, this lamp lights up and indicates what imbalance is present and indicates the corrections that need to be made. So this is the Nadi Pariksha method of diagnosis in Ayurveda. Having diagnosed the condition, the physician then chooses between 6 different types of Ayurvedic therapy, which are mentioned in the Charaka Samhita in chapter 22. These are Langhana, that is therapeutic fasting. It is done under medical supervision and not a random fasting or not a dietary fad. This Langhana helps in reducing body weight. The opposite of Langhana is the Bruhanna therapy, where it is a nourishing kind of therapy. There is a growth in the body, there is an increase in body mass, a gain in body weight. The other 4 therapies are Rukshana, that is drying therapy, Snehana, oleating followed by Svedana, that is fomenting or steam, as is shown in the image here, and Stambhana or stopping the flow. So where would the flow be stopped? Let's say there is an excessive bleeding, there is a wound and there is bleeding, or there is excessive menstrual flow. These can be stopped by consuming certain astringent herbs. So Langhana, Bruhana, Rukshana, Snehana, Svedana and Stambhana are the 6 types of Ayurvedic therapy that the Ayurveda Charya might decide upon. Ayurvedic treatments are classified in Vagbhatta's Ashtanga Hridayam chapter 14. These are termed as Ayurveda Chikitsa. These can be of 2 types, one called the Shodhana and 2 the Shamana type. Shodhana or the purifying or the cleansing type of treatments completely remove the aggravated doshas from the body. They restore the imbalance from the imbalance to the balance. The Shamana type of treatments are more palliative, they are more balancing. So they simply balance the aggravated doshas, they pacify them, but it need not result in the removal of those doshas completely. Both the Shodhana and Shamana Chikitsa types are further classified into internal and external treatments. For example, the Shodhana internal kind of treatment is the very popular term we associate with Ayurveda, which is Panchakarma. And then there are external treatments too, like external massages for various parts of the body. The Shamana treatment makes use of various herbal and mineral and animal product formulations as medication to palliate or to balance the doshas. The Panchakarma that we have so often heard of consists of 5 types of cleansing or purifying treatments. Vamana or therapeutic vomiting, where the patient is made to consume certain medicated formulations, certain decoctions, which then induce vomiting. We have Virechana, which is therapeutic purgation. This means the consumption again of certain herbal formulations that causes the body to start the excretory process through feces and through urine. So toxins are lost either through vomiting or through excretory processes. Then comes Basti or Vasti, which again is of various types, and these are various forms of enemas given through the rectum, as is seen in the figure here. Then comes Nasya or herbal oils and various medication added through the nose, through the nostrils, and they relieve any kind of tension, stress, or any kind of illnesses associated with the ENT. The last of the Panchakarmas is Rakta Moshana or blood letting. As you can see, leeches have been put on the skin at the specific places, and these leeches extract the bad blood, so to say, and this bloodletting helps to clear the toxins from the person's body. So the Panchakarma consists of Vamana, Virechana, Basti, Nasya and Rakta Mokshana. The Ayurveda Charya may prescribe any one or more of these based on the patient's condition. There are various types of external Shodhana treatments. Only some of them are listed here, like Shirodhara, which is using medicated oils and putting them on the forehead and on the hair region, which relieves the mental stress, the facial stress. Shirodhara is prescribed for people suffering from anxiety, from depression, from any kind of mental disorders, and simply to release stress. There are various types of oil massages. What is shown in the image is Pada Abhyangam, which means a bathing of the foot. And this oil massage also relieves the pressure points are pressed and it relieves a lot of stress. A full body massage or massage to any specific parts of the body based on the ailment is prescribed. Then there are various types of bastis. We have already seen the rectal basti, but there are also rid basti for the heart, for heart disorders. There is netra basti to release the tension, the stress on the eyes, to treat dryness of the eyes, to treat retinal issues. And there are various other such kinds of external treatments available under the Shodhana category of treatments. Next come the Shamana treatments, the palliative or the balancing ones. These are also mentioned in Vagbhatta's Ashtanga Hridayam, and these are of 7 types. Pachana or digestive treatments, Dipana, hunger producing, Kshuta, hunger tolerance increasing, Truta, thirst tolerance increasing, Vyayamaha, exercise therapy, Atapaha, exposure to the sun, and Marutaha, exposure to the breeze. All of these Shamana therapies make use of various medicinal preparations, plant-based, animal-based, mineral-based formulations in various dosage forms as suitable for the individual. Some of these Ayurvedic dosage forms as listed in the Charaka Samhita are Swarasa, that is juice extracts, Kalkaha, that is herbal pastes, Kwataha, herbal decoctions, Himaha and Fantaha, which are cold and hot infusions respectively. So these are the 5 major dosage forms in which Ayurvedic medicines are given. Other than these, we also have Ushnodakaha or hot water preparations, medications prepared or consumed with hot water. Takraha, medicines that are supposed to be consumed with buttermilk. Ghritam, ghee or clarified butter is another important carrier for Ayurvedic medications. So there are many ghee-based preparations. Paniyaha, which are herbal drinks. Mantha, mashed drinks. Mausarasaha, as against popular belief, Ayurveda not just talks about vegetarian or plant-based medication, but also when energy is low, it prescribes the consumption of meat and meat products in specific formulations, of course, and one of them is the meat soup or the Mausarasaha. Yavaguhu, which are herbal gruels. Yusha, broth of pulses, like a thin dal that we can have. Avalehaha, which are herbal jams. An example of an avaleha is the chavanprash, which we might have heard of or even consumed. Khandaha, herbal granules. Many of the Ayurvedic medicines in current day are in the form of tablets like herbal khanda. And of course, the lepaha or the ointments or the pastes, which are the herbal ointments. So these are the other dosage forms: avaleha, khandaha, and lepaha. These three images are shown on the slide. In this lecture so far, we have looked at various Ayurvedic diagnostic methods, the tenfold method, the 8 body examinations, Nadi pariksha. We have looked at the 6 major types of Ayurvedic therapy and further classified them under Shodhana and Shamana treatments and looked at both internal and external types of these treatments. And we have looked at the various dosage forms or formulations in which Ayurvedic medicines are prepared. In the image shown on the slide, you see a man preparing an avaleha on the wood fire, and it is made in utensils made of certain elements. It has certain proportions of the various herbs that need to be mixed, and also it needs to be consumed at certain times in a specific manner. With this, we will just pause the video and ask ourselves a few questions. Kindly match the items in column A with those in column B. Here are the answers. A diagnostic method is Nadi pariksha. Therapeutic fasting is called Langhana. Shodhana treatment type, Panchakarma is a Shodhana treatment. Vyayama or exercise is a Shamana treatment type. And herbal decoction is referred to as Kwatha in Ayurveda. With this, we come to the end of lecture 1 in Ayurveda, where we began by talking about what is Ayurveda. We discussed its history through the ancient text and its ancient practitioners. We delved into the depths of the fundamental principles of Ayurveda in terms of the Tridosha theory, the Vata, Pitta and Kapha Prakritis, the Dosha-Dhatu-Mala theory, the Agni, and how the Agni helps to maintain good health. The definition of health as per Ayurveda, illness as Ama or the accumulation of Ama in the body. And we concluded this lecture with an overview of Ayurvedic treatment strategies. We will continue with more interesting topics in the second lecture on Ayurveda. Thank you.